When you're working on documentation in the EHR, whether that's building templates, modifying forms, or setting up flow sheets, you've probably run into a situation where you're wondering if something should be structured or if it should be left as free text. In a lot of cases, that decision may seem small in the moment, but it can actually have a pretty big impact on how data is used down the road. So I want to walk through what we mean by structured versus unstructured data, and more importantly, how to think about those decisions when you're doing design or build work. Let's start with structured data. This is the kind of information that's captured in predefined fields, where the system already knows what kind of value it's expecting. So things like drop-down lists, checkboxes, radio buttons, numeric fields, or coded lookups tied to a terminology. You're not just recording information, you're selecting something in a way that the system can easily recognize. That's what makes it so useful. It can be searched, reported on, trended over time, and shared across multiple systems more reliably. So when you're thinking about reports, dashboards, or data moving between systems, structured data is what makes a lot of that possible. Now on the other side, we have unstructured data. This is narrative or free text type documentation, where clinicians are describing what they're seeing, how they're interpreting it, and what decisions they're making. It gives them the flexibility to explain context in a way that structured fields can't quite capture. You'll see this most often in things like progress notes, assessments, and care plans, where clinicians need to tell the story of what's going on with the patient. It's not just about recording data, it's about explaining what that data means in a clinical context. So when you look at these side by side, it's not really a question of which one is better or worse. Structured data helps systems understand, reuse, and move information, while unstructured data helps clinicians explain what that data actually means in context. In most workflows, you actually need both. So when you're designing clindoc build, understanding which one to use where isn't always that straightforward. So free text fields really give flexibility in how they're capturing information. Users can type in what they need, they can use speech to text, or they can drop in a smart phrase and move on. They're not working through a long list of fields or trying to translate their thoughts into predefined options. If the situation is complex or doesn't fit with the choices, narrative gives them the space to explain it freely. But at the same time, structured documentation brings a huge amount of value. Clinicians work through a set of fields that collect discrete data that can be trended over time, referenced later, or considered in decision support algorithms. And where this really starts to show up is where someone comes to review that documentation later. Structured data makes it really easy to scan. You can quickly pick out key values, compare them over time, and see patterns and things without having to look at every single detail. But on its own, it doesn't always tell you the full story. The narrative section gives context around what was happening, why certain decisions were made, and how the clinician interpreted the situation. So just like when you're documenting, when you're reviewing a chart, you actually need both. If you scan to see the data points and you notice a trend or you're starting to see something that stands out, you're going to go to the contextual free text information to get more of a complete picture about what that meant at that moment in time and how it was factored into the care delivery. If we look at things like reporting and analytics, the benefits of structured data are pretty clear. It can be pulled into queries, grouped, compared, displayed on dashboards, and used in metric reporting. It's got a consistent format, which means you can rely on it to represent the same thing across patients, workflows, and time. Narrative or free text is a little bit different. It contains a ton of valuable detail, but it's not as easy to work with in a structured way. It's not impossible, it's just not quite as simple. So going back to your build decisions, if something needs to be reported consistently, chances are it will need to be captured discretely. Of course, you're also going to need to think about the system side of everything. The more structure you introduce, the more there is to maintain over time. The build will include discrete question and answer combinations, value lists, terminology mappings, and connections to other parts of the system. As workflows change, clinical practice evolves, or standards get updated, that all needs to be reviewed and adjusted to make sure everything stays aligned. From a config perspective, unstructured fields are quite a bit easier, but they don't give you that same level of consistency, and it can be a lot harder to get the information into reports, dashboards, or considered in decision support algorithms. So in the end, it's really not about one being better than the other. It comes back to being intentional about where structure is needed and where flexibility adds more value. Every structured element you include should have a clear purpose, whether that's supporting care, system functionality, or reporting. And everything else still needs space for clinicians to actually articulate what's going on with the patient in a way that they can add context. So figuring out whether to use structured or unstructured in certain things usually requires collaboration. You need something that works for clinicians, supports quality and regulatory needs, and fits within the IT systems that you have in place. If you want to continue the conversation or see how others approached these decisions for specific workflows or documents, you can join us in the Dragon Network. The more exposure you have to how other people are thinking about this, the easier it becomes to facilitate those conversations for your own work. It's all we've got for today, and I will see you again next time.